I'm often asked, especially at family gatherings, why do cancer patients have to pay so much for their treatments? While I believe that this is a complex question that deserves more than just a 10 to 15-minute discussion, I do agree that the cost of cancer care can quickly add up, especially if the patient wasn't provided with a full financial counseling at the beginning of their treatment. Hi, I'm Benjamin. In the last episode, we looked at the medical bill after it arrives. I have spent the last 20 years on managing the administrative side of healthcare. Today, we're going to move earlier in the timeline before your treatment begins, where most of the cost is actually decided. Most patients don't realize how much of their medical bill is actually dependent on a series of choices made in the first parts of their care. Today, we are going to look at these choices and how they can affect you. Imagine this: you walk into a restaurant with a party of 10, you get seated at the table, you're not presented with a menu, the staff doesn't tell you what you're about to order, and they say that don't worry, leave it to us, we'll order everything for you. And best of all, they don't provide you with a pricing before they order everything. How likely is it that you'll be happy with the bill provided to you at the end of your meal? For many patients, that's the experience that they have when they go into a healthcare institution, but it doesn't have to be that way. Healthcare institutions, especially hospitals, often have financial counselors who are able to sit you down and properly counsel you on the full pricings, or at least the expected pricing that you can expect at the end of your treatment. However, most patients or their family members don't ask. It's either because they are either unaware that they have the right to ask, or they don't know the right questions to ask. In this episode, we're going to walk you through the various categories that can be found in a medical bill and the questions you can ask in order to clarify any questions that you may have so that you can be as fully prepared as possible when the medical bill arrives. Do you know how many things that can actually affect the total cost of your cancer care? Take a guess. Do you know that there are up to 7 things that can affect how much your cancer care actually costs? Many of them are direct ones, but there's also one particular category that we'll be discussing later that you may not have thought about. More often than not, the patient or the family members often get blindsided because the bill turns out to be bigger than it should be to them. However, it was not because anybody was necessarily hiding anything, but because the estimate was just incomplete. The first category is something that everybody knows about: drugs. The single biggest variable and the single biggest determinant on how much your cancer bill would be. Often, the biggest difference is whether a drug is branded, generic, or biosimilar, whether is it on the Singapore's cancer drug list, and whether your insurance accepts it. For some newer therapies, drugs can cost almost 60 to 70% of the total bill. Next, we have administration and facility fees: the infusion chair you sit on, the time of the nurses to care for you, the daycare charge. It's usually fixed per session, and it varies between settings in the public or private sector. Thirdly, we have scans and lab tests: your CT scans, PET CT scans, MRIs, blood panels, tumor markers. These run continuously throughout your entire treatment, not just at the start. And number 4, we have doctor fees. These are consultation fees that they are charged whether you are visiting them in their clinic or if they come and visit you in the hospital. We also have procedure fees done by their surgeons or even the doctors in the clinics or in the hospital. Multidisciplinary tumor board fees. Next, we have supportive care. What is this, you may ask? Well, cancer patients often suffer from various side effects from their cancer medication. These include vomiting and even dry mouth. Supportive care is essentially, for example, medications that help you to stop vomiting or help you to have less of these side effects. Although they seem to be small or often forgotten in initial cost estimates, they can quickly add up and up to even 10 to 20% of the total in many regimes. And number 6, we have unplanned inpatient admissions. These are admissions to the hospital that were not part of the planned treatment journey. For example, if you happen to suffer from an infection due to your compromised immune system or have other complications during your cancer treatment journey, any single unplanned admission to a hospital can easily add 5 figures to your total medical bill. Lastly, we have indirect costs. Imagine this: losing 3 to 6 months of your income, having your mortgage to pay off, and other bills to pay. having to pay for transport, additional help at home, and even accommodation if you are outside Singapore. Imagine all these costs adding up on top of the medical bills to pay. This is why indirect costs are a major factor for any patient to consider. Besides the total cost of treatment, I'm often asked, why does the cost of treatment vary so differently for people with similar cancers? First of all, the levels of your settings matter. For example, if you were receiving treatment in a restructured or more commonly known as government hospitals, the cost of your care will be lower than if you were receiving it in a private provider. But did you know that even within a government hospital, the levels of your care also determine the total cost of your bill? These factors include the level of your subsidies and whether or not you're opting for private care within a government setting. Same drug, same nurses, same protocols even, but very different prices. Secondly, we have the drug source. Branded originals, generics, biosimilars. Where on the cancer drug list the drug sits affects greatly the cost of these drugs. Thirdly, insurance panels. Whether your provider sits on the panels of insurance providers affects greatly the claim mechanics and your out-of-pocket payments. Number 4, the stage of your cancer and the intent of the treatment. For example, treatment for an early stage cancer is often much more standardized and costs less than treatment for advanced or later stage cancers that often require individualized regimes that vary much more in cost. Lastly, we have line of therapy. First line, second line, even third and fourth lines. Have you ever wondered what each of these terms means? Well, generally speaking, first line therapy involves the most recommended treatments according to the latest guidelines in cancer. They can involve drugs, radiotherapy, surgery, and even bone marrow transplants. Each line of treatment tends to involve newer and more expensive options. Now, you may be wondering, what can you do with the whole load of information that you have just received? Not to worry. Just remember these 3 important questions that you can ask your healthcare provider before your treatment begins. First, what does my MediShield Life and insurance cover? And what's my expected out-of-pocket payments across the full cost of treatment? Out-of-pocket simply means what you can expect to pay out of your own bank account. Second question, what costs are likely to come up that aren't in the initial estimate? For example, supportive medications, any scans or lab tests, or even possible admissions to hospitals should your condition require it. Lastly, and this is a question that most patients or their family members are either afraid to ask or don't know to ask, is there an equivalent alternative that costs less? And would you treat your own family member with it? What you're essentially asking is for an alternative treatment plan that can cost less money, but is still just as equivalent in its clinical outcomes. Don't be afraid to ask about costs. Remember, you are the one that will be paying for it. I would like to close this episode differently than I have originally planned. Here's the thing nobody will ever say to you out loud, so I'll say it. Nobody cares about the cost of your healthcare more than you do. Not your doctor, not your insurer, and not the hospital billing department, as well-meaning as they may be. The one person who cares about your treatments, financials, is yourself. Sometimes your family. That's about it. I sincerely hope nobody listening to this ever has to use what we talked about today. But if you or someone you love does end up at the crossroad, I hope you'll find that you already walked in already knowing what to expect and what to do. I'm not here to make you an expert, but hopefully I've made you more prepared.